What's the best approach to breast augmentation for very athletic patients? I think the two most important considerations are implant selection and implant position. My approach is almost always the placement of a shaped, form-stable device in a subpectoral position through an inframammary fold incision. Most very athletic patients have a fairly slender frame, a fairly thin layer of subcutaneous fat, and a small starting breast volume, perhaps an A cup or a small B. With not a lot of tissue to conceal the implant, the shape of the implant is going to determine the shape of the augmented breast. A shaped form-stable device has the natural shape of a breast. It's a bit taller than it is wide. I think that's the most appropriate selection for these patients. And the point of maximal projection is low on the implant compared to a round device. If you place a round implant in a patient with not a lot of soft tissue coverage, you get a round-looking breast that's not always that natural appearing. With a shaped device, I think you get a much more natural appearing result. Regarding placement of the implant, I strongly prefer subpectoral placement. A big concern about subpectoral placement that you'll find online is breast animation, which means that when the muscle contracts, the implant can jump around and the muscle contraction can also change the shape or the appearance of the breast. This is completely avoidable if the pectoralis major muscle is released across the entire length of the inframammary fold. The advantage of subpectoral placement is that you get coverage of the upper pole of the implant by the pectoralis major muscle, creating a very smooth natural slope to the upper pole of the implant. If an implant is placed in a submammary position on top of the pectoralis major muscle, you tend to get a rounded contour on the upper pole that creates a very obvious augmented appearance. If you're an athletic patient seeking breast augmentation, find a surgeon who's comfortable with the placement of shaped form-stable devices in a subpectoral position. Ideally someone who can show you a lot of before and after photos of those kinds of patients and who has athletic patients who are breast augmentation patients in that practice who can speak to you about their experience.